Okay, great, thanks. Okay, so I thought maybe since we don't have much time, we'll try to at least touch the surface of what I would like to talk about. Basically, I'll talk very briefly about my background, my education, and what I've done so far, and then maybe explain very briefly about the underlying concept of Tibetan medicine, and based on that, I'll talk about the consultation. What are the things that consist in typical Tibetan medicine consultation, and what kind of a treatment or a remedy that we design for the client. So my name is Tenzin Namdul, and I did my Tibetan medicine study at the Menzikang. Menzikang literally means in Tibetan, Tibetan Medical and Astrological Institute. It's in India, Dharamsala. Graduated from Menzikang in '97. After that, I worked at different clinics. Menzikang has, for right now, 58 different branch clinics all over India, and a couple of them in Russia and in Nepal, and then in Europe. I worked there for almost 11 years, from '98 to 2008. And last couple of years, I headed the clinical research department at the institute. I'm registered under the Tibetan Medical Institute, or Menzikang, and the Central Council of Tibetan Medicine. But here in the U.S., I'm an unlicensed Tibetan medicine practitioner. And then I travel around quite a bit in India, in Africa, in Europe, and then moved over to U.S. Before I came over to U.S. in early 2009, came here a couple of times to teach and do a workshop in Tibetan medicine. Moved here in 2009, early 2009, and basically one of the main reasons for me to come over here was really to have a more formal training in research methodology. And so I came here to do my graduate study, and just turned out that I didn't get any credit transferred. The university didn't give any credit, so I started all over again as a freshman, finished my BA in anthropology, and then after that I did my certificate in public health core concept. So that's a very brief background information about my education and my work. And I thought maybe you guys might like to look at the institute where I studied Tibetan medicine. And basically this whole kind of a cluster of buildings on this small hill. Oh, I can use this. Yeah, all this. That's the Tibetan Medical and Astrological Institute, or Menzikang. Yeah, it's really nice, small, peaceful area. It's almost like when first time when I went to Cambridge, that made me remember my own institute, because it's almost very like it almost like it's designed to just study and try to absorb the knowledge and wisdom over there. So that was great. So underlying concept of Tibetan medicine, I thought maybe one of the main things that people emphasize a lot in Tibetan medicine, and people tend to understand about Tibetan medicine, is about its unique emphasis on mind-body relationship in Tibetan medicine. So I thought maybe I'll very briefly touch on that concept, and then the concept of 5 elements, and I'm sure most of us here would relate to that, especially in Chinese medicine or Unani medicine or other practices, so much based on the traditional healthcare knowledge and wisdom. So even when I was listening to Drew's presentation about naturopathic medicine, I do see lots of similarities, and in some way the overall understanding of not just the disease but of the health is just so important. And when you talk about the 5 elements, it's hard not to talk about the 3 principal energies. And in Chinese or Indian medicine or in Unani medicine, they have the same concept, but they explain it in a little bit different way. So in Tibetan medicine, we have 3 principal energies. And then the one thing I thought maybe for all of us to understand a little bit about how in some way all these different systems have such similarities, Indian, Chinese, or Tibetan, or Persian medicine, or Greek medicine, because it's basically an integration of 4 major traditional medical systems that we can see in Tibetan medicine. And And in some way, if we look back in the medical history from 6th, 7th, 8th century toward the 10th century, there has been lots of interaction, especially in that part of the world, and interaction between the Persian physician, Chinese, Tibetan, Indian. So at that time, the integrative medicine actually have already started over there, even though in the West Europe side, with Roman Empire falling down, there isn't really much happening at all. So actually in 8th century, when the first medical conference was held in Tibet, there was the kind of a Tibetan medical symposium or conference that was happening at that time, and that's how all this major medical system have integrated, and that's why we see lots of similarities in all these systems. So I thought, okay, talking about the mind-body relationship, to be more clear and specific, if we talk about the etiology, or if we try to understand the very causative factor of disease in the Tibetan medicine, even though when we talk about the disease, the whole point is really how actually from state of health, it can lead to disease. But if you look at the cause of disease, in Tibetan medicine, basically there are two important classification when it comes to the etiology. One is the immediate cause, and then the other would be distant cause. So immediate cause basically is what we perceive all the time, and even in conventional medicine and biomedical system, people talk about it: diet or lifestyle, seasonal changes, external influences, and those are the things that we get exposed to all the time. And when we're talking about for example, a lifestyle, it's not necessarily about the physical activities that we engage in, but it involves the body, mind, and speech behavior that we engage in every day, and then how they can actually impact the changes in our physical state. And then if we talk about the distant cause, so in Tibetan medicine, the distant cause is always related to our mind. So that's the root cause of everything. So that's why in Tibetan medicine we have this particular Tibetan term called Ringyu and Nyegyu. And it literally means, Ringyu means something which is in distant, which we usually are not aware of. But the Nyegyu means the immediate cause, which we always tend to address that. And in some way we're not able to, quite often we're not really able to go to the root cause of the problem and able to solve it, because we are not really looking at that cause which is sitting behind the curtain, and which we often would ignore it. And then I thought maybe talking about the 5 elements, the concept of 5 elements. One thing, I'm sure all of us are aware of that, but basically from the Tibetan medicine perspective, how we actually look at it. So 5 elements, when you say 5 elements, not necessarily a common elements. We are really looking at the inherent qualities of each of these elements. So that's, in that sense, we are explaining it in a metaphorical manner. So when we say, for example, fire element, we are literally looking at something that generates heat, something that's penetrative, something that's fluidity or light. We look at the air element, again we look at all these inherent qualities. And that's how I think that sometimes when we look at the Chinese or even the traditional Indian medicine, which has influenced Tibetan medicine a lot, there's a slight different way of interpreting how we actually use this concept of 5 elements. So just like in most of the traditional medical system in the Tibetan medicine too, we usually say that both at the macro and micro level, everything is based on 5 elements. So these 5 elements work synergistically. It can't stand by itself on its own. For example, for the earth and water element to maintain its function and mature, it certainly needs a fire element. But just to make sure the fire element, the state of homeostasis that we talk about in the conventional medical system. So it working very much in that way. But just the thing is, it's far more simplified and based on the elemental effect and the inherent qualities that we relate ourselves to the environment and vice versa. And then the 3 principal energies. So one of the concepts that we would talk a lot in Tibetan medicine or Indian or even in Chinese and Persian medicine or Greek medicine is the three humors, or in Greek medicine they would talk about the four humors. In Chinese they would talk about the yin and yang, or qi. In Indian medicine they would talk about the three dosha, which means the three faults. In Tibetan medicine, the three principal energies is the same thing. We say nyeba sum, and nyeba sum literally means three faults. So we have a lung, tipa, and pekin, and if we can look at each of their characteristics, lung actually is a manifestation of air element, and it has a characteristic of all those things which are associated with air element that I spoke about before. So characteristic of rough, light, cold, subtle, hard, and mobile. So in a way, when we talk about lung, it's a movement energy, and when we say movement energy, it's all the neurology function in our body. So even the correlation between our brain and the physical body, it's a central nervous system, peripheral nervous system. So lung is responsible for all those, maintaining all this function. And tipa is the manifestation of fire element. The core characteristics that is associated with fire, as we discussed before, are oily, sharp, hot, light, melodious, percussive, and moist. So there's the energy of heat, and basically we are more talking about the endocrine system. Anything in our body that needs a heat in order to function, it's been facilitated by the fire element itself. And then the third energy is a pekin. It's a manifestation of earth and water element. It has those characteristics of oily, cool, heavy, blunt, smooth, subtle, and sticky, and it's a cold energy. So in a way, when we say cold energy, basically it's all a lymphatic function in our body, but more than that, it's all the fluids in our body that helps to again balance the state of our physical and mental state. And all these three principal energies they always help each other to maintain the state of balance. One of the reasons that these energies are pronounced as or termed as a threefolds is, as long as they're in the state of balance, we are in the state of health. But the moment they are in imbalanced state, just like in other traditional system, then we would pronounce ourselves as in the state of disorder or disease. So I thought, talking about the mind-body relationship, I just prepared this flowchart, maybe just to make little more sense about it, how mind leads to body. And so we have, what I did was, we have a mind here, and we all have a mind here, and we can talk a lot about how actually we can classify between the consciousness and mind, and even a soul. So we won't really go into that, but just so for us to know that, okay, we all have a mind or a consciousness. When we are born, every second that we spend, we tend to grasp both the ignorance and knowledge. But basically the thing is, we always tend to have certain level of ignorance, and that ignorance, as far as Tibetan medicine or Buddhist philosophy is concerned, we say ignorance would lead to the ego or egoistic feeling. So I. And this ego or egoistic feeling would actually generate these, what we say in Tibetan medicine is the three poison or mental poison: desire, attachment, aggression, or closed-mindedness. So, and these three afflictive emotions actually form our consciousness. So that's why we all have this. We all have it's not that all desire is bad, but we all have a consciousness based on our afflictive emotions. Now the thing is, that's why we usually say that, the things on which our physical and mental state is based on, it itself could be the cause of the disease or a suffering. So the moment that happens, the combination of 5 cosmophysical elements, which are the 5 elements that we talked about: earth, water, fire, and space, and the 3 psychical factors which we talked about here, the 3 mental poison. The moment they club together or they merge, at that very moment we are in the state of dynamic equilibrium. Everything. I mean, if if we get a little bit angry based on our fight and flight situation, we tend to produce certain hormones more than our body should require, and that can lead to, if that happens for a certain period of time, that can lead to some kind of a disease or a chronic health issue. And same thing goes with if we have a certain level of closed-mindedness or obscuration. We don't really care much about other opinion or other people's view about how you actually should live your life, and we actually get so absorbed into that again it can lead for us to lead a certain kind of a lifestyle that can actually generate more of certain hormones in our body that can on the long run can cause a health issue. So that's why, so it's a very kind of a simplistic way of interpreting how we actually look at the mind-body relationship. And when that happens, Lung Tipa Pekin, which we discuss about being 3 principal energies in our body based on the 5 elements, they get into the state of imbalance. Or if we're able to be mindful and watch our thoughts, our lifestyle, we can maintain that dynamic state of equilibrium. So that's the mind-body relationship we talked a lot about in Tibetan medicine and in the Buddhist philosophy too. But again, the interesting thing is if you reverse and if you know that, okay, why for example I'm having insomnia issue, or having problem with my sleep, or why I'm having a heartburn, or why I'm having a migraine headache, or why I'm having a lower back ache or pain, we just know that, okay, we have this combination here, and it's so often we have these afflictive emotions which is so ingrained in ourselves. And in order to check on those emotions, the thing is really to understand the whole thing is the ego. If the more we watch our egoistic manifestation, the less we would fall trapped into these afflictive emotions. So try to being less egoistic would actually always help to be more secure, confident, cheerful, creative, attentive, all those things that come so naturally to us. And the moment we become kind of protective about your own ego, then we tend to feel more insecure, less confident, and less creative, and always kind of uptight about your own situation. So that's how we're looking at it. And I thought I'll just show this also the ancient text, and one of the main mode of teaching at the Tibetan Medical Institute it's memorization. So we have these are the ancient texts, but most of them has been now reprinted in a book form. But major part of the four tantra is the fundamental text of Tibetan medicine, and major part of that we need to memorize it. So basically, every year, the first 5 years of the training, during every exam, we need to first finish the recitation first, and only then you will be eligible to sit for the written exam. So it involves lots and lots of memorization. So for the consultation, basically for typically Tibetan medicine consultation would be a 60-minute or an hour consultation, and basically it will consist of urine analysis, pulse reading. Then based on these two information, and also with the interrogation that you would have with the client, we would identify a particular person's inherent constitutional nature. And once we have that, and most of the time these are based more on someone who is not necessarily having any kind of symptoms or chronic health issues. So basically this is really more about maintaining the health and promoting well-being. Then you would, what we would do is try to help design an individualized diet and lifestyle regime, or try to modify it if they are engaging in certain diet and lifestyle that might not be good for them in the long run. And the whole focus is really if you are able to, just like in other medical system, especially the traditional or naturopathic medicine, the whole point here is really if you are able to design your own diet and lifestyle based on your own constitutional nature, it really helps to stay in harmony or be in the state of balance. And then if needed, would prescribe Tibetan herbal pills. So in the form of treatments, basically there are four major way we try to treat or address the if someone has health issue. But it starts with the diet and lifestyle, and the medicine and accessory therapies. And most of the time, the whole emphasis would be really on a diet and lifestyle. So if someone comes to me, it could be a situation that a person might have one or other symptoms, and but there isn't really any pathological manifestation at that time. So the person might go to ER or see a doctor and would run a test and might not come up with anything. So everything is fine, but the person might be still having some kind of a presentation of symptoms. So really the thing is that person living and trying to live in harmony with his or her own constitutional nature. So that really helps a lot. So diet and lifestyle modification is a very important thing, just like any of the other traditional medical system. And if needed, then we would prescribe some medicine, and most of the time it happens that diet and lifestyle will be complemented by some form of Tibetan herbal medicine. And the last resort would be, if it doesn't work, then we would have a accessory therapist. And again, in therapies, they are both kind of a gentle and a drastic therapy, and in a gentle, again, all this body work in the form of massage, acupressure, how you can manipulate certain part of your body. Those things comes into there, and anemia and purgative. In the drastic, then it will be a bloodletting, golden needle therapy. In some way, we also use moxa. So basically, like for example, if someone have a chronic migraine issue, or someone is in a post-stroke situation where actually some part of their body is not moving, or they are not able to have any kind of movement, so the certain drastic accessory therapist really works so well if we combine that with the diet and lifestyle and medication. So basically, this is not in Dharamsala, but up on the border on Himalayan region. So every year for 2 months, the medical students and some doctors from the pharmacy and the staff from there, we would go up to mountain and camp there for a month and a half or almost 2 months. And this is the exact place where we do every year. So these are all the tents that we have to camp. And these are just a local kind of a restaurant or kind of shake over here. But this is on the way up to Ladakh. Ladakh is on the north, way up north side of India. And for first 4 years, every students have to go up there. So we have to camp up there for a month and a half. So I almost know every trail or path that, way. So we need to know which side you can find which particular medicinal plants, or which side you can find some kind of basically it's the side of the mountain which receive more of the sunlight, and then the other side which doesn't really receive much sunlight and is covered by shade all the time. So based on that, the doctors or the teachers would tell the students how they can go around. So that's a very brief introduction of myself and Tibetan medicine, but if you have any questions, you're welcome to do so.